Revolution. It is National Women's Health Week, and so we've teamed up with Prevention Magazine to bring you some insider tips on how you can make the most out of your next health screening. Now, it can definitely be scary when you're going for a test and you're not really sure what to expect, but trust me, that's no excuse. So here to help simplify 3 tests that many women fear is Prevention Magazine's contributing editor, Dr. Tasneem Bhatia. Welcome, Dr. Bhatia.
Thanks for having me.
This is such an important topic because, as we both know, fear of a certain test, especially a screening test, is a major blocking factor for so many people. They just won't go for the test at all out of this fear. Let's start with one of the big ones, mammograms. What have you found?
Well, first of all, women always put their health last, and mammograms are a very important life-saving test. And at Prevention, we want to remind women that these life-saving tests can be made a lot more comfortable. Right. So with mammograms, the fear there is pain. So there are things women can do to minimize pain. Now, in the process of getting a mammogram, the tech will do some tugging and pulling,
right,
pull the breast between 2 paddles, and it is a little bit uncomfortable, especially if you have smaller or more dense breast.
Right.
But there are things you can do to make the experience a little bit more pleasant.
So what do you normally tell people?
Some of the keys to that are, first of all, schedule that appointment, especially if you're perimenopausal. Schedule that mammogram appointment in the first 2 weeks of your cycle.
That's right.
To avoid those hormonal
right.
shifts that make the breast really sensitive.
Exactly.
And then in the week leading up to your mammogram appointment, stay away from caffeine. It just
right.
makes the breast very tender and very sensitive.
And you know what I normally tell people is that, as you said, for smaller breasted women, the mammogram can be a little uncomfortable because it crunches down, the machine crunches down on the chest wall. For larger breasted women, it's the opposite. It's uncomfortable because it's hurting their breast. But it's quick, and if you have a good technician, they will minimize that discomfort. So that's really important.
Absolutely.
So let's go on to the second one, colonoscopy. Now we're going to the other end of the body here. Fear factor
yes.
is, I don't know, a tube going all the way up your colon, right? Is that what people are saying?
There is, and I'm sure you know, we have patients that always put off their colonoscopies because they are terrified. And you've
right.
got a couple of different fears here.
Or embarrassed.
Or embarrassed, exactly. I mean, the first fear is just pain and that right. you're going to be aware of the procedure.
Right.
But I think we all forget that you are sedated during the procedure.
And
you're
that
not aware of
sedation
it.
works so well, right?
Exactly.
We always tell people they are not going to be aware of anything. They're not going to be uncomfortable. So don't fear the actual procedure. But what is it that they fear almost as much?
The other part of the colonoscopy is the prep. And
right.
the prep is very dreaded for a number of different reasons. First of all, for 24 hours leading up to it, you're on a clear liquid diet.
Right.
For the 7 hours leading up to it, you're taking in about a gallon of a salty, very foul-tasting solution.
Right.
And then the point of all of that is to clear the bowels. So some patients will even have abdominal pain, nausea, and vomiting.
Right.
So none of it chalks up to a very good experience.
Right.
But there, again, are things you can do to maybe minimize that and make the experience a little bit better.
And we need to remind people that a colonoscopy, which they're done all the time, is a very low-risk procedure, and it is done to find either colon cancer or precancerous polyps that are treatable on the
right.
spot. You don't have to go back and have them removed later, so you only have to go through it once, and if everything is fine at an interval of 5 to 10 years, right?
Exactly.
So you only have to go through that misery, you know, a couple of times.
Exactly.
So let's go to the other end now, the endoscopy or upper GI scoping. What do people tell you that they dread about that?
So an endoscopy is very similar to a colonoscopy, except now we're starting at the esophagus and we're trying to diagnose reflux, upper abdominal pain, or swallowing disorders.
Right.
Similar fears. You're afraid of pain, you're afraid of being aware of the procedure, and you're
right.
really afraid of gagging or vomiting. So the key here is to remember you are sedated.
Right.
And in that sedation process, you're not going to, first of all, be aware of the procedure, and secondly, you're definitely not going to have the gagging and the vomiting that so many people talk about.
Exactly.
I think another fear is that after the procedure, what are you going to feel like? Many patients will complain about a sore throat or
right.
trouble swallowing. So using an anesthetic spray will sometimes take that down.
Yeah.
And then also remembering post-procedure softer foods,
right.
ice cream, popsicles, pudding, things that get down a little bit more easily.
And with any procedure like this, as we said with the mammography, you want to find a center, a doctor, a technician, an anesthesiologist that will work with your fears and address your concerns rather than dismiss them and ignore them. That really is the key. And that can make all the difference between someone going for these tests, which can be life-saving, or avoiding them completely.
I agree.
Right?
I absolutely agree.
This is so important and such useful information, and really educating yourself about what to expect can be half the battle. So, Dr. Bhatia, you're going to stick around with us,
yes.
and when we come back, we'll share some tips that can make your exams even more accurate. We'll be right back. Dr. Tasneem Bhatia, who's joining us as part of our exclusive partnership with Prevention Magazine for Women's Health Week, a week near and dear to my heart.
Yes.
Now, before the break, we were giving you some advice on what to expect during some common medical tests that women tend to fear, but we also really want to share some insider tips that will help you get the most accurate results from these exams. Now, let's just go back for a second and talk about mammograms.
Okay.
Because there is so much controversy, and there has been for the last couple of years about who should get them, what age. This is really an individual decision that a woman needs to have with her doctor. Usually, we start them at age 40. But again, if a woman has any high risk factors or family history, that will be individualized. And whether it's done every year, more frequently, less frequently, a woman really needs to talk about that with her doctor. What else would you say?
I agree. I mean, and I get asked these questions all the time. When do I do a mammogram?
Right.
Do I really need to do it? And like you said, I really believe it's a discussion with your physician, and you need to personalize that decision.
That's right.
There are other things, though, that you can do as well to make sure those mammogram readings are more accurate.
Right.
For example, don't wear lotions, perfumes, deodorants the day of the test. It
Right.
will affect the reading.
Yep.
Another really important tip is look for a radiologist that really has experience in reading a mammogram.
That's so important.
You want somebody that spent at least 50% of their time reading mammograms, so you get a really good, accurate result.
Yeah.
And kind of with the same thought, you also want to stick to the same doctor. If you're going to a doctor and you have a relationship with that doctor and they've seen your breast from visit to visit,
That's right.
they're going to be able to pick up on subtle changes on those findings rather than someone who's maybe seeing you once here and once there.
Yeah.
So really staying with the same physician, I think, is
that's
important.
critically important. I agree with you, Taz. And the other thing is, if women do need to switch, get those images and bring them to your next radiology center or breast imaging center, because they need to compare them. Let's go to the second one, colonoscopies. What are some key tips to maximize the accuracy of the procedure?
So to really make sure that colonoscopy reading is accurate, there are some things you can do. First of all, schedule that appointment in the morning. We know that the polyps are picked up better in the morning due to less physician fatigue. We also know that in the morning your bowel prep quality is a little bit better. And then realize that there are things you can do to make sure that the actual procedure goes the way it's supposed to go. For example, with the bowel prep, you know, maybe having a chaser as you take the prep, so all that prep gets ingested. So as you drink the prep, which doesn't taste so great, following it with a little bit of ginger ale or a sports drink.
Clear
so that
liquid
you can
only.
Get down. Clear liquid only.
That's
so that's a really important tip. And then leading up to the procedure, lighter, smaller, blander meals.
And remind people what age they should start.
It varies for women, but we usually say at least by 40 you need to have one, and then definitely by 50 they should be doing regular colonoscopies.
And any family history, you start earlier.
Yes,
and
exactly.
it is so important. People say, oh, it's so disgusting that they're going to be looking in my colon. Understand that, as you said, if the prep is not good, the doctor will not be able to see the wall of your colon, and therefore will not be able to evaluate for polyps or any abnormal lesions. And guess what? You'll have to go back. So that's really important. Finish up with a simple test, blood test. Not necessarily such a big deal, but if you're having your lipids or your cholesterol panel checked, there are some things you can do to maximize the results. So go through that with us.
Yeah, so this happens to my patients all the time. You get set for that cholesterol test or that lipid panel, but you've just been on vacation. And then you get a result back that's completely disheartening. So the key here is, in leading up to that lipid testing, really make sure you're not coming off of a vacation or a holiday where you've eaten foods that you may not normally eat. Usually what I say is the 3 days leading up to that testing, stay away from high fat and really starchy foods. That'll give you a more accurate interpretation of where your lipids really are, instead of the skewed result from what you may have been doing over the last few days.
So we're talking about cholesterol, the good and the bad, and triglycerides, and it is important to have them checked. Some doctors will recommend that you're fasting. Some will just do a quick one not fasting. But again, if it's abnormal, if you don't prepare with the tips that you've shared with us, you might just have to go back and get another one.
Exactly.
So all important stuff, and really, really key to keep us healthy in the future, which is so great. Taz, thank you so much
You are welcome.
for sharing this important information. And when we come back, Tim will help some viewers take a closer look